Well, good morning, everyone. I know this is early. It's definitely early for me. I'm on the East Coast, but I am not a morning person. And normally it's somewhere around 10:30 or so before I engage. But here we are. So we have life that continues to happen. And I am kind of a last minute addition to the conference, if you will. So let me go ahead and go through some slides here in the beginning, and then I'll introduce myself, and then we'll go ahead and get started. This is the second day of the conference. If you were on yesterday, you have gotten a little used to the software. But this is next couple of slides here, just talk about how this is going to work and where you can put in your questions. So these presentations, as well as the files, will be available on the Hud Exchange. Right now, you're just in listen only mode. If you need to see the caption, just click the button below. There is the attendee guide. It's out. That gives you some resources if you get lost a little bit along the way. As far as questions, if you scroll down below the broadcast, you'll see the Q&A box. That's where you can enter in your questions. And I am by myself today, so between myself and Sidem here, we'll figure out how to get your questions. You can go ahead and submit your questions anytime during a presentation. I will try to address them as we go along. And then at the end, we'll kind of like clean them up a little bit, make sure we get everybody's question answered. I don't know everything and not afraid to admit that. So if it is a question I don't know the answer, you will have my contact information and you can send it in and we will address your question. The chat function is also there available. And if you do need the help, there's the email address that you can get some technical support for that. So we don't have any polls, but we certainly do have the Q&A that's available there as well. If you want to download the Slido app, there is the number that's in the chat that you can enter into Slido. That'll give you the ability to use your smartphone if you want to, or a tablet, or on another screen, and you can enter in your questions that way. That way you don't have to scroll down if you don't want to, and you'll be able to see everyone else's questions. So I am James Heyman. I'm the director of the Entitlement Communities Division in the Office of Block Grant Assistance. We are one of several offices, or several divisions rather, within the office. We handle the cities and counties for the CDBG program. We have the lead on the CDBG-CV program and the NSP program. My other colleagues in the State and Small Cities Division, they handle the states and insular area CDBG programs. They also have the Recovery Housing Program. And then we have the Disaster Recovery and Special Issues Program, which those of you who are CDBG DR grantees are probably very familiar with the folks over there. Then we also have the Financial Management Division, which has the Section 108 program. So it's not necessarily a negative thing, other than you give me, other than a TA provider to provide this session for you, but it gives me an opportunity to thank all of you for participating in the conference. Our conference last July was very well attended. This one is as well. So we have over 5,000 registrants for this one. And I think given that, as well as our attendance that we have on the webinars we've done the last year and a half or so, we've had numbers anywhere between 600 and 1,200 participants in those webinars. So this has provided us with a growing vehicle, if you will, to reach out to those who are interested in the program, to go beyond the physical space. So I appreciate your time today. And I hope you enjoyed yesterday's conference. We still have 4 more days left to go, especially if you're participating in one of the basically CDBG courses that we have. So we have also our technical assistance providers to thank, who have joined us during this conference to put on these sessions, as well as to help instruct in the basically CDBG program. And of course, we have a lot of the HUD team members that are here as well that are presenting and instructing. So thank you again. So this is what we're going to cover today. I don't have 300 slides or anything like that. So we're not going to try to break anyone's brain this morning. We're just going to kind of go over the basics a little bit. But these are the topics that we're going to go over today, and see what kind of questions you have. So first, we want to talk about that difference between what an emergency grant payment is versus rental assistance. The CDBG program does not have a rental assistance component. It's not an identified activity within the Housing and Community Development Act. It does not exist within the entitlement regulations for activities. That's something that people are familiar with in terms of like tenant-based rental assistance or some of the other programs like ESG. So what CDBG does have is the ability to make emergency grant payments, which puts us in that interesting space of being a gap filler or a bridge between an emergency situation and a more permanent solution. So these are not income payments, and we'll go over the regulation here in a minute, but our regulation offers that definition of a subsistence type payment. And again, it's a little different for us, but primarily grantees are putting in place rental assistance programs. So that's why we're using this term here. And we actually do have a quick guide that will be posted on the HUD Exchange soon, that I'll go over a little bit of that here today, but it goes into more depth in terms of how exactly are you going to merge together these different programs in order to put together that program itself and kind of wedge CDBG in there, if you will. So this is where the regulation is actually at, and it's in an interesting spot. It's actually in the ineligible activity section. And if you're one of those folks like some of us who like to go through the regulations and kind of chase down the old notices and the previous regulations and see how things have changed over time, I guess that's kind of the hallmark of a policy nerd, I guess, if you will. But you'll see that there are several carve-outs that exist in that ineligible activities. For our state grantees, they're more than well aware of how they can outfit their rural fire stations and things like that with equipment because of one of those carve-outs that exist in there. These carve-outs were brought in when CDBG was created. If you know anything about the history of the program, or you'll find out in the very beginning of basically CDBG, there were multiple programs that existed that were merged together in the Housing and Community Development Act of 1974 to create what is CDBG today, which has been a longstanding program that has served thousands and thousands of people over the years. So for the purposes of the CDBG program, the income payments is defined as those subsistence type payments. And what that actually means is that it's a series, which means we're just talking about one series of payments, not multiple. Again, this is not a rental assistance program. We are a component that assists with bridging between an emergency situation and a more permanent solution. So these series of payments should go to an individual or family. And those 4 uses are listed on the screen: food, clothing, housing, whether it's rent or mortgage, and utilities. Now, the reg continues on by saying that it excludes emergency grant payments. So in other words, subsistence type payments is still not something that is acceptable, but emergency grant payments are. So the regulation does give us how you can implement that series of payments to an individual or family for any of those 4 items by saying that it can be a series of up to 3 consecutive months. So that's the boundary then that's placed on it. That's what makes it not a rental assistance program or income payments. There's a time limit on that. Also, the payment does not go directly to the individual or family. It's made on behalf of them to the provider, which makes sense if you look at the way it's actually structured. The other thing is that this is need-based. So if you look at the way it's structured in there, up to 3 months, that means you don't have to pay 3 months. It's what is the need of the individual. So if the individual only needs 1 month or 2 months or part of those months, then that's what's going to be paid. So you'll see throughout the presentation, need-based, necessary, reasonable, policies and procedures. These are going to be themes that you see throughout these slides. So how did we implement this with CDBG-CV? So if you look at the notice in that section that's on the screen, that 3B5F(i), what we did was we presented an alternate requirement within the notice to extend the period. So we only waived the pieces of the Housing and Community Development Act and the regulations to extend that series of payments from 3 months to 6 consecutive months. In that alternate requirement, if you want to use that, you will have to change your policies and procedures in order to use that. If you have an existing set of policies and procedures, then it's fairly easy to go ahead and adopt that versus making something from whole cloth. So part of your policies and procedures, you have to be able to document how you determine what the level of assistance is. That's a fancy way of saying need-based, or perhaps maybe you want to put in a dollar threshold. We've seen some grantees do that, where they have maximums in which they are willing to use, which is okay. You can certainly do that. It makes your dollars stretch more. You also have to have a way in order to document those necessary and reasonable cost. And we're going to talk a little bit more about that when we get to the section on arrearages a little bit further down. So the next 2 slides, we get questions on. So I thought I would go ahead and stick those in here. One of the questions we've seen a popularity on is, can we say that those that are unvaccinated cannot receive CDBG benefit? So the answer here is just this, what's on the screen. As the CDBG program has not published any of these requirements beyond what exists already for the limited clientele national objective and for the public service activity. So we're looking at the income status of those who come in for benefit. We are looking at what their need is and what the costs are. That's all we're looking at. We do not make a distinguishing between who's vaccinated and unvaccinated. We have not published that requirement. And as grantees, you know that you can put into place requirements that are above what HUD gives you as a baseline for the CDBG program. And we'll talk a little bit more about that in a couple of slides. So the next one, I figure someone's probably going to ask about clothing and food. Not covering that in this presentation. It's a much bigger topic, but here are a couple of quick things for you. One is a reminder that we don't do gift cards. Again, as the regulation states, these payments are made on behalf of the individual or family. So we don't preload gift cards and hand those out. You cannot track the expenditure. That's not the way it works. So we are not FEMA or another organization. We need documentation. And having said that, we want to make sure that your policies and procedures outline what you're willing to do in terms of documentation, how you're going to document and determine what need is, as well as those necessary and reasonable costs, which is where we usually advise grantees to seek some kind of a discount or a wholesale type cost, in particular when it comes to food. You can do that by having an agreement with a grocery store or a supplier, and the family is able to, individual or family is able to get food, and then you reimburse the provider themselves once they turn in the receipts and documentation for that individual or family. So these next few slides are connected to the rental assistance quick guide that we will be posting, but I see that we do have some questions. So let me go ahead and take a look at those and see if we can get those taken care of. Okay, so the first one is, how do we verify the COVID hardship at this point during the pandemic? We've had calls from potential applicants that they are out of work sick and fell behind in rent. What does HUD suggest in terms of providing proof of the COVID hardship? So at this point, we are kind of in a strange spot, I guess, if you will, in the pandemic itself. We're coming up on year 2 of this, right? So at this point, I think if you are going to be documenting this, we've seen a lot of loss of employment. It is really that easy to do the tie back to say that the individual had lost their employment during the pandemic. That emergency order is still in place. That's still documentation that holds, as well as if your local government or your state government still has an emergency order in place because they lost their employment or they have a need during those times. That's the easiest way to document it. Did I just hear you say that rental assistance is only up to 3 months past due rent? Was it one time up to 6 months past due? So we're going to hit that question when we get to the arrearages section itself. We're going to talk about how arrearages work. And for the annual CDBG program, it is still a series of payments of up to 3 months. And for CDBG-CV, it is up to 6 months. But we'll talk about how you actually cover those past costs, those arrearage costs, if you will, when we get to that point. Is HUD looking at the current income or after the loss of income from job? So we're looking at, well, there's kind of 2 things I guess you need to look at if you kind of break that question down. So you need to have what their current income is, but you're also documenting the need. So there may be a case where the individual had not been employed for several months and they developed a need, and then suddenly they find themselves employed. So that's where we're going to kind of fall into that area of how you're actually going to document the need. And so you have their current employment with the limited clientele national objective. Of course, at least 51% of the folks that are served have to be low to moderate income. So they may find themselves all of a sudden over income. That doesn't necessarily mean you can't serve them, but they won't count towards your low to moderate income benefit for the program itself. So as a reminder, we still have in place as well the 70%, if you will, overall for your grant to serve those that are low to moderate income. Next question. Good morning. The city has been paying 3 months or $6,000 towards rent or mortgage, HOA, and electrical utility payments. We would like to expand this program. How would this work for residents who have already been assisted? Well, if they've already been assisted, they've already had their series of payments. So you need to find a way to meet that need outside of the CDBG program. Discuss in detail how to document hardship assistance in the files. Does HUD have any Excel sheets or formats that will assist grantees? So how you're actually going to document that is what needs to be outlined in your policies and procedures. That is your choice. We give you several ways to document income, from using self-certification all the way up to using letters from an employer, their earning and leave statements. That's up to you. But the question disappeared. But in terms of us providing Excel sheets and worksheets and things like that, HUD traditionally does not provide those things for you. We do have some technical assistance items that are out there that are not HUD documents. If you look at it this way, if you send HUD, say, your policies and procedures, we will opine on them. We'll review them, but we don't approve. We don't accept. We do that because that moves us out of the impartiality space in terms of our ability to monitor you. It's the same way with the Inspector General. They don't even do that on our own stuff because then they move out of that impartiality space. It's very hard for them to fulfill their audit duties if they approve something. Okay. All right. This is a follow-up question to the other one. Also, with the above scenario, what if the resident has made payments after the city's 3 months of payments? Would that interrupt the consecutive nature of the assistance? So these are a series, and we often get questions about whether or not you can kind of spread out the 6 months. You can do 1 month now, wait 2 or 3 months and then do another month. That's not how it works. So we will talk in the arrearages section a little more about what that means in terms of a series. You do have the ability to skip payments if you want, but there is a covered period in which this is eligible. So you can't start and stop and spread that clock out, if you will. Interesting question. Can the CDBG-CV be used for a mental health program? Not the topic here, but the answer is yes. That would be a public service. That is an eligible use of CDBG-CV. Well, lots of questions this morning. You guys are very active in the morning. Okay, I sat in a CDBG-CV webinar last week that stated we would need to be able to document the client's ability to make future payments at least 1 month. How would you recommend that this be done? They also mentioned that this would be monitored. How would you suggest be documented in the files? So that is an interesting question. That is one of the things that we do have in our arrearages document that is posted online. Again, CDBG is a way to get somebody from an emergency assistance to a more permanent solution. That doesn't mean that if you don't have that documentation, you just let them drop off. It means that as a grantee in your policies and procedures, you need to have a way to get them to that more permanent solution. So you have to document those efforts. We'll talk a little bit more later down about extra requirements that you can add in there. But the section that I'm getting ready to go through, we'll talk about partnerships and things like that, where you need to be able to assist the beneficiary into getting somewhere. So if you want to look at it this way, ambulances just get you to the hospital. When you get to the hospital, is when you're going to have that more permanent solution. So this isn't as much as cutting a check and kind of moving on your day and then putting things in IDIS and saying, yay, I accomplished it. You need to be able to have a program that's actually going to help someone get from one space to another. And that's crucial with this. It doesn't mean that your rental assistance or your emergency payments are ineligible. It means that you're providing a solution for beneficiaries. I want to go ahead and move on. I'm going to kind of keep where we're at here because the questions just keep coming in. And then that way we can kind of get through the presentation a little bit more. And we should have plenty of time at the end for more questions. So if we're going to look at the strategic planning and how to coordinate and your design and things like that, one of the things that you should be doing is kind of looking at the landscape around you. What are your other resources that are available? Who are your other public and private and nonprofit partners that you have? What pots of funding do they have that's available? There is a lot of money floating around. I know a lot of grantees had set up rental assistance programs, and then all of a sudden Treasurer ERAP came along with like dump trucks just full of money. And we have grantees who are literally stuck because that's the only activity that they built. And of course they did that kind of early on as a way to kind of help out and try to stop the situation, try to mitigate what was going on in our community. But one of the things we have found kind of assessing where they're at is that they didn't do this. They didn't look and see what else was available, who else was in the space, and work towards kind of building that partnership. And again, with CDBG, you're looking to fill gaps. You're looking as a way to kind of wedge CDBG in a space where that's a segment of the population that's not being needed. Again, this is a low moderate income program, and a lot of these other funding sources usually address people who are below that, or they're available for other populations, other incomes that are able to get assisted. So there's a unique place for CDBG. Again, you got to kind of move past that mindset of we're just going to cut checks and kind of move along and report on accomplishments. You've actually got to think a little bit more about how you're going to implement this activity. So we have a few steps we'll kind of go through, and these may seem kind of elementary, but these are also reflective of where we've seen this not work very well for grantees. So this is a good reminder. And again, this is going to be in the quick guide. It's posted in a lot more detail than what I'll go over here, including some of these other programs that are available and how you can use those and what those are actually used for. But one of the things you need to do is just do a needs assessment for your community, or if your state acting directly, you need to do that same thing. But our primary target should be who's at risk of being homeless, or who's most likely to be at risk of being homeless. That's one of the things that we want to try to mitigate with CDBG, again, so that we can get them from that emergency situation to that more permanent solution. Now, I know yesterday there were folks in a couple of chat who had posted places where you can get really good data. I know there are a lot of state level offices who have offices who do data and economics, who have provided a lot of very useful data for their locality. So there will be plenty of places where you should be able to get this, but this is essentially what you're going to be looking at, which is very similar to what was used for the actual allocations. And we know that this is kind of moved all over the place. Again, we're coming up on the 2-year anniversary of the CARES Act itself here, about another couple of months. So you could be in a very different spot now than where you were before. But these 4 things that are listed on the screen is where you should be looking at, is sort of your first place to go, if you will. Now, there may be something unique to your community You may have another data marker that's available. You may have continuing change in your economic situation as well that's not reflected in, say, national data that's emerging that you need to account for and to include within that assessment. So the next thing is just making an inventory of what's available. Again, this is where you need to kind of branch out a little bit. I was a grantee myself. You know, I've been city, county, state, regional. You know, partnerships are what make the work actually successful. So if you're in a space where, you know, there are other pots of funding that are available, maybe you're in a county that does not get continuum of care funding, but there is an agreement where they may be able to expend funds within your county, go ahead and create a relationship with them. But you've got to kind of look at the landscape and see what's available. And also some of those resources may be on a regional level or on a state level that you'll be able to use. Again, you know, we're looking for providing a more permanent solution for folks and making sure that you can link together all of these resources. So you've got to be able to identify them first. So the next thing is to collaborate with them. Enter in agreements if you need to, intergovernmental agreements, or if it's within your own locality, interdepartmental agreements. Use those agreements to your advantage. Use them as a way to leverage funding. Sort of a word of caution, if you will, you know, is to make sure that they understand programmatic requirements. Even if you put a penny of CDBG in a project, it's considered a CDBG project. So you want to make sure that they understand what the rules are. The best thing to do is to have a cohesive document that outlines and balances all of these requirements. So you know who has stricter requirements than another. So you know exactly what kind of documentation you need. You know exactly what your staffing level should be in order to implement that program. And you need to know how to report on your performance and what everyone's documentation requirements are as well. That could be a handful if it's not done. So this is a necessary aspect in order to set up a successful rental assistance program. You know, the next thing is prioritizing. As you know, with CDBG-CV, we do have a duplication of benefits requirements. We'll be covering that over in the basically CDBG program. I believe it's on the last day, a little late in the day, but we'll have a session on that in the class where we'll talk more about that. Unlike a duplication of benefits in the disaster recovery program, we don't have a pecking order, or in other words, who goes first. Instead, what we're looking at with duplication of benefits and CDBG-CV is making sure that the most appropriate source is used first, and then others follow after that. All right, the last thing on this is just making sure that you have that buy-in and that support of everyone that you're collaborating with. Everyone knows their role that they should be doing. You know which segments of the population you're addressing with which one of those programs, and who goes first and who's after that. That you can leverage the most out of those resources and serve the most people that you possibly can, and make sure that you have built in here a way to get people from that emergency situation to a more permanent solution. Then lastly, there's just some reminders of what I just talked about, but implementing this program is something that's crucial. And then as a federal agency, just like all other agencies, are concerned with making sure that you're evaluating, making sure that you are self-monitoring or self-auditing, making sure that you have all of your documentation and that you're reporting out on your performance that you have. These self-assessments are very crucial, not only from the standpoint where HUD comes and monitors, or if you're a local government that's being monitored by the state, or more importantly, if you expect to have a visit from the Inspector General's office, that everything's in order. So you want to make sure that you have a clean program. We don't have to be concerned with paying money back if you have solid policies and procedures, file maintenance, identified roles, and your financial policies and implementation of that are lined out so that we can follow the money, if you will, from when it is deposited in your line of credit all the way down till it is dispersed for the beneficiary, and you have documentation for that. Before I move on to the next one, we'll take a look at the questions again and see. We'll pick up some more questions here if I can find where we left off. Okay, so COVID tieback. What if the applicant lost their job during the pandemic and is seeking rent subsistence payments? But this is because they choose not to meet the employer's vaccine requirement. Is this an acceptable tieback? So there's lots of reasons why they may not want to meet the employer's vaccine requirement. As I said earlier, we don't distinguish between those that have been vaccinated and those that are not. You may certainly choose to do that if you can back that up in your policies and procedures and why. I will talk about that in here with this, but sort of a word of caution. Some of those reasons may be for a religious exemption that they have. So you can see where you could put yourself in a position where someone may say that they're being discriminated against on religious purposes. That's not a space you want to be in. So how you would actually document that tieback is to just say that the individual lost their employment during the pandemic and leave it in that. You don't have to go into areas where you may be divulging some HIPAA information for that individual or their personal choice. Just make it that simple. They lost their employment during the pandemic. That's an acceptable tieback. Our local field office suggests we expand 3 months of assistance to 6 months. How does the lead-based paint requirement factor in? Well, we're going to talk about that here in the arrearages. So we will definitely hit that here at the end. That I see food assistance items cannot be a gift card. We have a hard time getting funds for clients, and this has been the easiest route. You said, oh, I swear my finger hit it. Maybe Sidam can help me wrangle these questions a little bit. So yes, we don't do gift cards. There are stories that I will not go into with FEMA where gift cards were handed out to folks. They were not spent on clothing and food. They were spent on other things. And there was not any kind of accountability for the expenditure. For CDBG, we're looking at that necessary and reasonable. You also have to have documentation for any of your expenditures. So gift cards are something we don't do at all. You need to have an agreement with a grocery store or a supplier. The individual or family would then get their food from them. They would then turn in that receipt with the family's whatever documentation you come up with in your policies and procedures to show that it's for that individual or that family. And that's the documentation you're going to use and pay back the vendor. You have to pay them back on behalf of that individual or family. Again, we're not handing out gift cards. We're not handing out cash. The CDBG program is it's not an ATM. There are some other questions in there that will be addressed in the arrearages. So let me go ahead and move into this. So you have the link that's on the screen here, and I realize it's really a long title for a document. And myself and one of my team members put this together, but we wanted to capture everything we could in that title. So it's long, and it is what it is. But this policy is for the annual CDBG program, as well as CDBG-CV, and when you're using your FY19 and 20 funds in order to PPR for coronavirus. If you remember, in the notice itself and in the CARES Act, you're allowed to use those funds for coronavirus activities and have the benefit of using the waivers and suspensions that exist within the CARES Act, as well as the notice itself. And there is a marker in IDIS you would check for those activities, and if they're public service, then that would remove them from the public service cap, if you will, which is one of the waivers and suspensions that you can take advantage of. So this is vetted HUD policy. I put that on there because often we do get asked about that. That is a fancy way of saying that our lawyers gave us the stamp of approval on this document. If you've been around the CDBG program for a long time, you know that this is a new policy for us. We have not published this before. The pandemic itself caused us to move into spaces where we've had to develop policy in areas that had not existed before. So if you think about a program that's been around since 1974, the answer is yes, we still have areas that we still need to develop policy in. And when those come up and we see them come in mass in particular, that's something that we go ahead and we address. So I'm going to go through kind of briefly what's in that document, but I encourage you to download that, in particular if you are paying for arrearages with either your annual funding or in order to address coronavirus, and hang on to that. This would be good documentation for you to show your state auditors or anyone else who audits. And if you have questions about it, go to your local field office and we'll get you taken care of. So there you see policies and procedures again. You've got to kind of build out what you're going to do for this. I wish it was as easy as just setting up an activity in IDIS and then just going ahead and having people come in and serve them. But you have to have a methodology to do that. And, you know, much like my younger self, where, you know, I would just spend money until the account had nothing in it. You got to be able to budget your funding. You got to have kind of a target. You got to kind of know what it is you want to do and have your thresholds and who you want to serve and all of that kind of stuff. So you got to have a methodology for your program, and that's going to be expressed there. These are sometimes called standard operating procedures. So however you want to call it, you've got to have that guide for your actual activity. So you need to identify what you're going to be using, which pot of funding, and what you're going to use it for. So as a reminder, your annual CDBG, you still have 3 consecutive months. We're straight following the reg on this. And you have that 15% public service cap, since this is a public service activity. So if we move to where you're using your CDBG-CV or any of your FY19 or 20 annual CDBG to PPR for coronavirus, you can take advantage of the 6-month extension that we have. And the public service cap has been suspended on that, which means you can go well above that 15% if you want, barring in mind whatever else you need to do with your activities, whatever else you're going to do with your program over the coming years. So, and as I had mentioned before, there is a CV flag in there that for your activities you need to click in order for it to be accounted appropriately for that. And most importantly, it'll take your 19 to 20 activities for CV out of that public service cap by using that. So, what can be used for arrearages? Well, you can use your annual CDBG, or you can use your CDBG-CV or your 19 to 20 that you're using for that. So again, this policy applies to both programs if you want to look at it that way. We wrote it that way on purpose because we know there are grantees that are kind of straddling the fence where they may be using CDBG-CV for capital cost and not that much in terms of public services, or they're just choosing to spend down, particularly on the entitlement side where we still have the timeliness test that's in place that's coming in. They need to make sure that they're expending their annual funds because you can't shelve your annual program and only worry about CDBG-CV. It will build up, and we've seen grantees trend in that direction, whereas they spend their CV funds, they're not spending their annual funds. So some grantees have found a balance between that. So some things that you need to kind of take a look at when you're putting together those policies and procedures is to make sure, this goes back to the question we were asked earlier, making sure that there is a second place for these people to go. And we'll talk about the other requirements here in a second, but it's making sure that you're leading them to a more permanent solution, and that by the time they're done being assisted with CDBG, that they're not just kind of out of luck and you kind of shake their hand and say, well, I wish you the best. We want to make sure that that program is designed in a way that we can lead them into that more permanent space so that they're not kind of left hanging out. One of the things you need in your policies and procedures is exactly how are you going to assess and document their need. Scrolling through the questions, there's lots of questions about that. That is something that you are more than welcome to come up with a methodology and run that by your HUD field office and say, what do you think about this? Again, HUD is not going to approve that. We're not going to accept it, but we will review it and we'll opine on what you present to us. But you have to have a way of actually making those determinations. You also need to decide what that funding level is going to be. And if we look across the portfolio as a whole, last time I kind of did the math, we were somewhere around $1,500, I believe it was, as an average. And I realize that's going to be off a little bit. There are certainly higher cost areas and lower cost areas, but in most cases, grantees seem to be using CDBG to make partial payments, or they're not going the entire 6-month period or 3-month period. In other words, they're just getting people in a space where they can get back on their feet. Again, that's up to you. If you want to have a monetary threshold with how much you'll do a month or how many months, you don't have to do the full 3, you don't have to do the full 6, but you have to have a determination on what you're actually going to do so that you have a rule that you can apply that's equitable across the board. In other words, you're not treating one individual or family different than others. You're not making exceptions and saying, well, we're going to go ahead and let this person have 6 months because they're my neighbor, but this guy I don't know, he only gets 2 months. You want to make sure you have that in place so that it's equitably applied. You also need to look for your duplication of benefits. Again, this goes back to the previous slides on how you're actually going to design your program and making sure that you're using the most appropriate source of funding for the person that you're serving first, and then move to your secondary, and if you have to, a tertiary source. Then you need to be mindful of your public service cap. So if you're using your annual funds for your 3 months, you got public service cap for sure. If you're using the others, you don't have to worry about public service cap, but that will eat into your total grant balance and what else you can do with your CDBG-CV grant. So we do see grantees that are using their 19 to 20 funds as a way to supplement their CV so that they can go ahead and take on larger capital projects with their CV funding and still be able to meet their public service needs. Then, of course, you also need to account for that 100-day visual inspection rule with the lead-based paint, which I will get to in a couple of slides to answer some of the questions that we had that came in the chat. So, additional requirements. We are advising simplicity. Don't overcomplicate things when you don't have to. I don't know why grantees would want to do that. Again, I was a grantee myself, and one of the places that I worked, they had very complicated rules for their public service activities. It didn't seem as if anyone was going to qualify, and hardly anyone was served. So you need to think about whether or not your extra requirements that you put in place are going to exclude or preclude anyone from participating in your program. That's something that you need to be very conscious about. Having said that, if we're looking at moving someone from a situation of emergency to a more permanent solution, it's certainly acceptable if you wanted to put additional requirements in, such as documentation that they're seeking employment because they've lost it, or if you want them to go through a credit counseling program, which you can use your CDBG funds as a public service to provide that for. Sure, you could certainly do that. I would say that's something that's definitely not going to exclude anyone's participation within the program. And lastly, if you're looking at those additional requirements, you got to make sure that you're not going to contradict the CDBG program. This includes the Act as well as the regulations. And the two sort of hot buttons, if you will, are that program-related civil rights requirements and those of equal opportunity. Again, we got to make sure we're not discriminating, we're not precluding people from participating in the program by what we put on it. That also means that if you have a requirement in there that may be a hurdle, in particular for those that are low income, whether it requires transportation or access, that you have a way to provide that for them as well, because that would be a barrier of participation within your program. So then just as a reminder, you got to meet that national objective, and you've got to be able to document the national objective. It's really basic in this sense. As I said on a previous slide, we're making sure that we're looking at that income in the individual. We have the self-certification on the low end. We've allowed folks to use the home self-certification all the way up to letters of employment and earning and leave statements. So if you need to have that documentation that you determine, you also need to have alternates for them. Obviously, if someone has been out of work for several months, they're not going to have an earning and leave statement. More than likely, they're probably not going to be able to get a letter from the employer saying that their position was canceled or they were relieved because of whatever circumstance it is. So you need to have a way for them to document that, which usually falls back to that self-certification. So this is the national objective that you'll use, that limited clientele. At least 51% of your beneficiaries have to be LMI. You got to document their income, the family size, and as I've mentioned several times now, you can do that in different ways. So your policies and procedures have to outline that. And again, as a reminder, I would not have just one way to do that. I would have your best way to document that income, and then have alternate ways to do that so that you can accommodate anyone who comes in. As part of your program design, you can certainly set up a separate activity. So if you want to have one activity that you'll be able to serve anyone who can meet that national objective that comes in and documentation, that's fine. If you want to set up a second one that is just a presumed benefit. So in other words, if you want to hone in just on the elderly, the homeless, the severely disabled, you can certainly do that as well. That would allow you to take advantage of the presumed benefit piece of the limited clientele national objective. That would also allow you to hit that niche of your population that may be left out in a much larger activity that you've set up. So in other words, you're able to carve out funding specifically for them so that you can make sure that that segment of your population is taken care of. So let's talk about let's actually just talk about arrearages itself. So again, the covered period. So what are we talking about in terms of a covered period? So that covered period starts at the date of assistance. So the date that you make that first payment, that's when the clock starts. And this is a series of consecutive months, whether it's 3 or 6 months. So that's your window. That's your covered period, as we'll call it. That's when those individuals and families are eligible to receive that assistance. You can't go outside that window. You can't break that window up. It's a series. So it's 3 months straight or 6 months straight. We have seen grantees that have tried to take this 6 months and sprinkle it out over a year. That's not eligible. That's not consecutive months. That's somebody doing funny math. It doesn't work like that. So in terms of your arrearages, what you can cover, what we have within our FAQ document is an example of using someone who comes in who's 4 months in arrears. So you'll cover all of the arrears part, all of those months within that first payment. So you'll make the first payment, plus you will pick up everything that they are in arrears within that. So in other words, if they are 4 months behind, the clock did not start when they went into arrears. It didn't start 4 months before that. The clock starts when that first payment is made. And you'll make sure you have documentation of the months that they are in arrears, plus that current month when you make that first payment. So during that period that they're in, that covered period, that 3 to 6 month period, whichever program you're using, you can pay 1 month all the way up to either 3 or 6 months, depending on your funding source. And you don't have to make full payments. So if the individual has the ability to pay part of their rent or their mortgage, again, this goes back to how you're actually going to document the need. So say they are a 2-income household and one of those people in the house is unemployed. So they only have half of the money that they need in order to make their rent or mortgage payment. And they're able to do that. You can document the need. You can document the necessary and reasonable cost, which means if there's funding available, you're not going to pay the whole month. You're only going to pay part of that month. And again, I can't stress enough that you've got to have a way in your policies and procedures of documenting that and making that determination. So how many months? We've gotten questions about what if someone is like under an eviction moratorium and they're 14 months behind. Again, we're kind of looking at that need and what's necessary and reasonable. We don't have a policy that says you can only do so many months. But you have to ask yourself, what's necessary and reasonable. So if they're 2 years behind and you're going to pay all that in your first month, does your policies and procedures allow for that? would you consider that a necessary and reasonable cost? Is there another funding source that could be used to help with what they're in arrears for? And again, in our FAQ, we chose 4 months because that seemed to be what about the national average was at the time that folks were behind. So in that case, you're paying 4 months worth of arrears plus the current month. So if you want to look at it, you're actually paying 5 months. But the way we look at it is you're making the beneficiary whole. In other words, you're bringing them current and you're taking them out of the emergency situation by paying the arrears and the current month. And then you need to be able to assess the coming months and kind of where they're at. And that's really where we come into, skipping payments or making partial payments based on the need of the individual and how things are looking. They may be able to go ahead once you pay their arrears and their first payment, say they can make the second month. So the beneficiary will pay the second month, and then they need CDBG to pay the third month. Or it may be a situation, as I just said, where it's a 2-income household, one of them is unemployed, and throughout the duration of that 6-month period, they may need assistance for a partial payment. Meanwhile, the other individual in the household continues to seek employment. So let's just say at month 4, that second individual is able to secure employment, and then they are able to make their full rental or mortgage payment. So at that point, then the need is met. They're able to make their rent and mortgage payment. So CDBG would stop at that point, and the individuals would be out of that emergency situation, and they would be able to continue moving forward with making their payments. So lead-based paint. We spent a lot of time working with our lead-based paint healthy home office discussing this. When exactly does that 100-day clock start? And that's because we're dealing with arrearages here. So it is easy if we go back to the 4 months, to say, if you're going to pay 4 months of arrearages, they're already in the 100 days. But when the clock starts is when assistance starts for the 100-day lead-based paint visual inspection rule. That is at the time of CDBG assistance. So once you make that first payment, your 100 days then begins. And at that point, then we'll look towards the end of around month 3, which is going to get you that 90-day marker, depending on what month you're in, of course. And you'll have to do your like little knuckles, I guess it is, that I don't know how to determine who's got 30 days and 28 days and all that. But by the time you get to that 100 days, your grace period's over. So you need to have that visual inspection done at that point in order to continue assisting them with CDBG funds. So that's good in a sense, because you don't have to worry about whatever period you're covering in the arrearages aspect of that, and you know that the clock starts then at that point. So this is a visual inspection. And of course, that is a concern when you're in a pandemic situation. And it may not be possible to do that on-site inspection. It could be that the company that's being used, or your municipality, or the family themselves don't want to put themselves at risk. That's certainly understandable in this case. So where it's not possible to do that, the owner, or as we'll refer to them as a surrogate, may be able to perform a remote visual inspection. With today's technology and having smartphones and computers, you can certainly work out in your policies and procedures that methodology, whether you're using FaceTime or Zoom or Facebook Messenger, whatever is acceptable that your inspector would need in order to have that individual walk around and use video, use pictures, things like that. In order to do that visual inspection remotely, it can be done. But your policies and procedures have to outline that methodology. It has to outline what kind of documentation is needed in order to make sure that that is complete and taken care of. All right, well, let's look at questions again here before we kind of move forward here. I'm actually going to pull it up on my screen because that seems to be a little bit easier than my gigantic thumb on my smartphone. Our program is only taking self-declaration form as income verification. Does that cover us completely? Also, is there a length of period to pay rents and utilities? We have some applicants that have been receiving assistance since CARES. Need more information on that. So yes, the self-declaration form is fine. You can use that. That's basic documentation. That's the most basic documentation that you can get for that. But in terms of receiving assistance since CARES, got to have more information on that. Does that mean you've been paying them with CDBG since the beginning of CARES, or does that mean that they've been receiving ERAP money? Got to have some more information. All right, well, it looks like I've answered most of those. If someone does not have a question that's answered, throw it back up in there. Maybe Sidem can help me figure out here where I got lost.
James, one thing, just so you know, we asked everyone to upvote the questions that they still want answered. So if you sort by popularity, you will hopefully see the outstanding questions at the top.
Okay, let's try that. Okay, yeah, that looks like I've hit. Yeah, it looks like I've hit those. So let's move on to the next section here. I will give you a qualifier on this. Not an expert on this topic. This was developed by our financial management division. And one of the things that we said when we first put this out was paying public utilities can be tricky in the sense that there is some assessment. And then if you're doing that, we encourage you to reach out to your HUD field office. This is a rather short Q&A document. I know that public utilities, I'm originally from the great state of Missouri, and we have utilities that are owned by municipalities. It's very popular in the Midwest. I do know in the Southeast, there are a few states that the state law actually requires the municipality to own the utilities. So there's a little bit of some quirkiness that goes on here. Again, this is vetted HUD policy, which means we have the stamp of approval of our general counsel. One of the main roadblocks to this is that a grantee can't pay itself. So if the utility is owned by the municipality using CDBG funds to pay themselves is not exactly kosher, but it can be done. It can be done. There's just a little bit of assessment that needs to take place. So these are just reminders of what we had talked about before. This is an emergency grant payment. So we're just going to go ahead and beat to death that policies and procedures and need-based. Again, you also need to have your coronavirus tieback, that prepare, prevent, or respond. How exactly does this activity meet that? And you've got to make sure you outline your documentation and all the rest of that stuff. Same thing. This is anything new is what we've been talking about. So there are some things in your policies and procedures you need to have that go beyond that. And this is where we're going to talk just for a few minutes about the actual assessing itself and what you need to include in there. So one of the things that we're looking at is that those costs that they have to be allocable and allowable under that 2 CFR Part 200 subpart E. And part of that is making sure, because that regulation states that those depreciated costs of items that were borne by the federal government, in particular, we're concerned with CDBG assets, that cost is not being passed on to the consumer itself. So that's part of what needs to be assessed here, is making sure that those depreciation of assets is not being passed on to the beneficiary themselves. The next thing that we need to kind of look at is a little more in terms of the per unit cost of actually delivering that utility. In this case, we're actually concerned with profit, making sure that the utility isn't budgeted in a way that they will actually receive a profit off of that. In other words, in this case, we are actually paying profit to the grantee themselves, and we just need to be able to pay for the cost of the utility and not the profit. So having said that, you need to kind of take a look at whether or not the grantee has this set up in a separate enterprise fund. And if it is set up in a separate enterprise fund, how are they looking at in terms of profit itself? And this is a much deeper financial analysis than probably your typical community development manager or staff member is going to be kind of taking a look at. This, of course, would require a conversation with them and probably reaching out to your field office to get the help of a financial analyst or one of your auditors at your state or local level itself. So if the profit is not indicated in that assessment, then you can just use the bill itself and consider that necessary and reasonable, and go ahead and pay that emergency payment on behalf of the individual or family. So again, in this case, following those cost principles, we're trying to make sure that there's not profit that's being pulled off that is going to the municipality that owns the utility. And then the last thing that we're kind of look at is exactly part of that itself, making sure that that it's an equitable distribution of that charge across the portfolio. That those per unit costs for the residential customers are just based on the cost of the utility itself. It does not involve anything else, whether it's depreciated cost or whether it's profit. And again, note at the bottom, if you're paying public utilities, we strongly encourage you to get with your field office. Your field office will probably reach back to headquarters to our colleagues in the financial management division, who are the ones who handle this type of stuff, and be able to help do that assessment and make sure that the CDBG grant is only paying for those costs that are eligible, and the ones that are necessary and reasonable in line with 2 CFR. So that is the end of my presentation. As I said, I didn't have 300 slides. That's a lot of slides to go through in the morning. So we have some time left. Let's go ahead and see if we got any other questions, or if everyone is off, like taking a nap or something like that. Can we use self-certification for an applicant that states that they were out sick, but hasn't lost their job and fell behind in rent? That's an interesting question. So in that case, I would say there you go. Mark is so handy. Now, if you can just make all of these boxes go away on the right-hand side so that I can see the whole question, that would be great. So if we look at a situation where an individual is working on an hourly basis, and let's say they do get COVID, or if they get some other kind of virus or some kind of illness or have a car accident and they're unable to work, therefore they're unable to actually make the same level that they are at. That's certainly appropriate to use documentation for that. Self-certification, I would say in this case, is perhaps rather slim, but that does come back to your policies and procedures and what you allow. Ideally, in this case, would be a statement from the employer that the individual was ill and unable to work, or to use their actual earning and leave statement to show that they had this gap, if you will, in their earnings. And that would be something that I would say is more appropriate than self-certification in this case in order to do that. But again, that is up to you and what you consider to be acceptable documentation. Can the CDBG program be used to pay rent on a modular home? Yeah, why not? In a lot of areas of the country, modular homes are part of the permanent housing stock itself, but that is the individual's home. So sure, you can do that. Condos, apartments, a house is a house, right? And modular homes are certainly acceptable. We're actually seeing more and more of that becoming part of permanent housing stock. What suggestions are there to help rental assistance recipients move to a more permanent solution? How do you go beyond that crisis intervention? That's a good question. And I think that is going to be based on what your available resources that you have at your local level. As I mentioned earlier, you can put in other requirements in terms of them seeking, credit counseling or job training, something like that. But you have to have a way to make those things available to them. So this is where you're going to kind of get into your overall program design and how you're actually going to structure that. And where else are you going to use your CDBG funds? So when you're getting into an area where you've got multiple activities that will be combined together, and those multiple activities are going to be what's going to get that individual to where they're at. So in other words, you would be funding other public service programs. A good example that's adjacent to this, but it's a good lesson to learn, is if we look at the recovery housing program itself. HUD is just a small piece of that. HUD is just paying for that that housing itself, but there are requirements for those individuals to enter in and be served with that program. And part of that is making sure that they're going through, addiction recovery. In some cases, they have to receive job training because they are on a different path. And that's kind of how you need to look at your design for the program, is what other activities or what other resources do I have to link together? And in a certain extent, that's going to come out of your needs assessment, where you look at the population you're serving and what exactly does that population need in order to get from a crisis situation to a more permanent solution. So that is going to be curtailed very much to your local level and what exactly are the needs of your community. An ERAP question. I want to make sure I understand a series of emergency grant payments. If we assisted a household with 3 consecutive months, then ERAP paid 3 different months. Maybe we assist same household with an additional 3 consecutive months. The answer is no. They're consecutive months, so it's a series. So if you assisted them for a period of 3 consecutive months, and then you break that off, you stop that period, well, that's it. You can't break up 6 months and say, I will do 3 months here, and then we'll serve them with another program, and then come back, 6 months later, and then do the other 3 months. It literally is a series of consecutive months. So you have to look at that. As soon as you stop CDBG in that case, then the benefit itself is stopped. Mark, is there any way you can help me move the boxes on the right-hand side so I can see the whole?
I'm sorry, I actually don't know what boxes you're talking about.
Well,
That's why I didn't move them.
it's where I see you and Melissa and myself on the right-hand side.
I see. I see. I think that's an individual control issue. Like, I think you should have a little, if you mouse over them on the top, do you see 4 buttons? And if so,
Yep.
could you click the one on the left? That would probably minimize it for you.
There we go. I don't use Zoom that much. I apologize, folks.
No problem.
Can assistant payments be made on water bills? Yes, that's a utility. So water bills are acceptable, electrical bills are acceptable. That certainly falls into that category. Is the program only for arrears? I keeps moving around. You gotta help me out, Mark. Okay. Can you provide another example of skipping payments? Explain how it doesn't conflict with the rule that payments need to be made for consecutive months. Sure. So as I mentioned, there's a covered period. So you need to look at the clock, and this was in the presentation, although it may not have been exactly clear, that that period starts when that first payment is made. So when you make your first payment, that's when the covered period begins. So that is the first month when that first payment is made. And then you need to walk out those consecutive months. So in other words, that is the window of eligibility, if you want to look at it in that sense. That is when the individual can be assisted is any time within that 3 and 6 month period. So if based on the need of the individual, they only need, say, 1 or 2 months, or they only need to have a partial payment, it happens anywhere within that covered period or that window of eligibility. So if you are paying for that first month, whether it has arrears in it or not, and say they have enough money to pay the second and third month, that's fine. You're going to document that they are able to pay that second and third month, and then say they need assistance in the fourth month because maybe they had a medical bill that came up, or something else happened with their employment, say they got laid off or they did lose their position, and they need assistance in that fourth month. Then you would document what you need to for the fourth month, and then as you come into the fifth month, you're going to do that same analysis again and see what the need is for the fifth month itself. So in other words, we're in a situation where it's not, hey, we made the first payment, so we're going to go ahead and we're going to pay your rent or mortgage for the next 6 months. You have to have a way month by month to be able to assess what the need is. But it all happens within that window of eligibility or that covered period. And that clock does start when you make that first payment. What we see are a lot of individuals who've had hours cut for a variety of reasons, or I guess that's indirect negative effects. It's a pandemic, family sick, increased bills, etc., and this leads to them being behind on rent payments. We know that they are LMI based on documentation. If you can scroll that one up a little bit so I can see the rest of it, because all I see is my question is. I guess that's it. So we'll see if we can find the other half of that question here somewhere. When will this presentation be made public? So after the conference is over with, we'll go through the process of having the files rendered. We will set up a spot on the HUD exchange to host the files. And also any of these presentations will go through the 508 compliance and we'll have those posted as well. So as much as I would like to say it'll be done next week, the reality is you're probably going to be looking at a couple of months by the time we get everything set up and through compliance and all the rest of it. We will send out on the HUD Exchange listserv a message when that's posted with a link. Can the program pay renters insurance? You know, that's a question we've gotten in the past. The answer to that is no. But if we look at a situation where you have a mortgage payment and you have your PITI, your principal, interest, taxes, and insurance, the program is able to pay the entire PITI as it's in one payment itself. When you start breaking these things down, then that's when we get into whether or not it's allocable and allowable. So sort of a question that's adjacent to that is paying property taxes to municipality. When the property taxes are not included within the mortgage payment, the answer to that is no as well, because that is a grantee who is paying themselves for those taxes, and taxes are a revenue. What if a beneficiary is assisted but is not utilized the entire 3 months allowed under our policies and procedures, and then they reapply? Can they be assisted again? No, it's a series of payments. So they were assisted. So they need to have another source to be able to assist them with that. Can you reimburse a landlord for utilities when the tenant is normally responsible according to the lease, but the landlord has paid to prevent shut off? If the utilities are part of the rental agreement itself, then you would not be paying the landlord themselves. You would have to pay the actual utility provider. So in this case, the landlord is not the provider of the utilities. The utility itself would need to be paid on behalf because they are the ones who are providing it. Are utility payments and arrears eligible to be paid with CDBG-CV funds? If so, are there any limitation with arrear payments? I would say, so we have not actually ventured into the arrears with utilities. I am very hesitant to say yes to that in case I'm incorrect, because our arrearage look in terms of that policy itself only covers rent and mortgage. That is something that I think we'll have a discussion with. Again, I'm very hesitant to say yes in case I'm incorrect. And then of course this is recorded and I have no idea how many people are actually on this. And then, well, James said we could do that. And I don't want that to come up in like an audit, right? So let me take that, and that's something that we'll definitely mull over. If the individual that that submitted that question, if you can email that to me if you want to identify yourself, feel free to do the same thing or go through your HUD field office and let them know that the Entitlement Communities Division is taking a look at it, and then we can get back with you personally on that as well. I thought utilizing regular CDBG funds for gift cards are eligible, but hard to track. We are not able to use CDBG funds for gift cards. You can't use either one for gift cards. It is not. It is not what we do. It does not fall in line with the regulation where you're paying the provider on behalf of the individual. So gift cards, whether it's annual CDBG or CDBG-CV, is a no. You said we should be using other appropriate sources before using our HUD funds. What if other sources are not getting funds to tenants fast enough to prevent eviction in some cases? So your other appropriate sources, I would say probably the most major one that we've seen is that Treasury ERAP money. That has literally stopped a lot of folks in their tracks in terms of expending their CDBG-CV funds. Again, this is where in your policies and procedures, you need to determine what the needs are, doing that strategic analysis and say you have needs that you're able to meet with CDBG-CV that you can do much quicker than you can with another source of funding. Sure, that's appropriate to do that. You just need to have a methodology for that. You have to have a justification as to why you're using one source over another source. And that's going to come back to what's appropriate, what's going to address the emergency itself. We'd be able to get a copy of the questions and answers. I don't know. Mark, I know we asked Citem to pull these down so that we can take a look at them. And I'm pretty sure these will be available with the recording. If I'm misspeaking, Mark, please let me know.
There's no technical reason we couldn't provide a copy of the Q&A. That's a question for you, I guess. If it's okay with you, then we can post it on this same session page later in the document section, which will appear at the bottom of the page. Is that something you would like us to do?
Sure. Yeah.
The one thing to note, obviously, because you're only one speaker, no one is replying to the questions with written messages. So it would just be a copy of the questions and not a copy of the Q&A, but all of the verbal answers would of course appear in the recording, which we'll post.
Okay. So heard yesterday, it's supposed to have a max amount of arrearages that we will pay as part of our policy. Is that a requirement or a suggestion? Again, this goes back to how you set up your program. And you were probably listening in on the housing models, the housing model session itself. So in your policies and procedures, you got to make that determination with how far back are you going to go in arrears. And again, this is where you're looking at what's necessary and what's reasonable. So obviously the example I gave you was going back and paying 2 years in arrears. Can you justify that is necessary and reasonable? Is that something that you're willing to back up in an audit? One of the questions that you'll certainly be asked in that case is what other sources of funding could you have used in order to help cover that amount that's in arrears? So that is up to you. We don't state in our arrearages policy that there is a maximum, but we do tell you that you've got to make a determination of need and a determination of what's necessary and reasonable. So again, this is a case where we gave you bumpers to keep you from going in the ditch, but there's absolutely nothing stopping you from hopping over those bumpers and putting it in the ditch. Lots of people do that. So that is going to be up to you to make that determination. We gave the allowance to pay for arrearages, and we gave you the guidance in terms of how you should be actually assessing and looking at that. But yes, you should have in your methodology what the actual amounts that you would be willing to cover in terms of not only the number of arrearages, but also a dollar figure that you're willing to go over. And again, that's so that you can maximize those that you're serving, but also so that you have a policy that allows you to apply it for everyone across the board. So if you were to say, we'll go back as far as 6 months and that's it, then that's something that everyone gets instead of having something that's loose. So you have to make sure that you have boundaries set up. Is it enough we provide information on job training programs to assist clients with being able to assume rental payments after emergency rental assistance ends, or must grantees require clients to participate in job training programs? That's up to you. If you remember back on that slide, we advise you to keep things simple, but you're certainly able to put those requirements in there. Again, the two cautions that I kind of give you there is, one, you need to ask yourself, does this extra requirement cause anyone any undue hardship in order to meet it? And then the second one is coupled with that, which is, are we going to be precluding anybody from participating in the program with this requirement itself? So this is where, again, we get into the situation of you're using another activity to leverage off of that one. So if you're going to have that in place where they need to participate in a job training program as part of your overall program design, do you have them linked together? If it's a requirement, you've got to have a job training program that's linked with that. If you're using CDBG with that, fine, that's perfect if you want to do that, because that's an eligible public service activity. But when you're looking at your job training program, you need to be concerned with accessibility as well. Do we have beneficiaries that will not have the ability to attend job training program? So then you may be able to figure out with a nonprofit or someone else a way to provide transportation to get to that job training program if it's not remote. So you've got to learn how to leverage activities and your other partners if you're going to put these other requirements in. Motel vouchers included for the homeless. We're not a voucher program. CDBG does not do vouchers. You can certainly go to a motel or a hotel and you can enter into an agreement with them. They would be actually the ones that you would pay directly for the homeless. We did see this quite a bit in the beginning of the pandemic. Down in North Carolina, this was very popular, where they had gone to several different hotel chains and entered into agreements, and that gave them access to a certain number of rooms. And then each one of the homeless individuals then, as soon as they entered into that room, that's when assistance began. That's when their time period began. Again, we're not a voucher program. We don't have a voucher component, but you are able to pay the motel directly as the vendor on behalf of the homeless person. Is the 3 or 6 month period a one-time, lifetime assistance, or per year of CDBG funding source? As we lean back on that regulation, it's a series of payments. So you can see if you get into a position where you're paying year after year after year, it's starting to look like a rental assistance program, which we are not in that case. Now, if you were to go several years and then assist the person again, that's something I want to encourage you to talk to your field office about whether or not they're eligible. Again, with public services, we're looking at new or increased service in this case. So if you're assisting the same individual over and over again, you're actually doing a rental assistance program. You're not doing emergency payments. If the first payment made is for 2 months arrearages, would that count as 2 payments? Will they still be able to make up to 6 more payments in the covered period? So if you're going to cover 2 months of arrearages, you would pay that in the first payment, which means you're actually paying the current month plus 2 months of arrearages. That's all in that first payment. So you're paying their current month plus the 2 that they're back. That also means that the clock started with the first payment, which means that there is 5 more payments that you may be able to make for that individual or family during that period, because that's when their covered period started. So it's not two payments. You're just making one payment that covers the 2 months of arrearages plus the current month. And then you still have your 5 more then that you have to assess need for. So if we provide 6 months of rent arrears, nothing else, lead is not triggered because no other payments are made within 100 days. That is correct. So what that question is essentially asking is if we pay the 6 months worth of arrears within that current month. So you're making them current on their arrears plus paying the current month, and that's it. That's all they're assisted. Then the beneficiary received 1 month during that covered period. So you have started the clock at that point. If they're no longer assisted after that, then you never get to the 100 days. So the lead-based paint visual inspection does not come up. What would you do in a situation where a landlord has another company collecting rent payments on their behalf, but the said company doesn't show ownership for the property? So I take it in this case, you're talking about where you have a management company that's managing the property. So in that case, then you would make the payment to the management company because they are representing the landlord themselves. So that is acceptable to do that. Can the program pay late fees? Unfortunately, that is not something that we do. We have encouraged grantees to seek waiving of late fees. Most places will do that, particularly during the pandemic. So late fees are not a cost that we cover. What's my email address? You want to shell me with email. It's on the first slide, but I'll give it to you again. It is james.e.hoemann@hud.gov. And we could probably put that in the chat somewhere. If you do send me an email, please be patient. I get a lot of email and we'll get back to you as soon as we can. To provide rental assistance for a client is a requirement that the property management company provide their tax ID. We have a case that such a company is refusing to release it to the grantee due to established policy not to. That probably, I don't know, to me, that sounds like perhaps maybe a local requirement that you have the tax ID. Really what we're looking for in the documentation is the statement that they have, or a lease agreement, or their actual mortgage agreement. In that case, to my knowledge, it is not a requirement of the CDBG program to have the tax ID. So that must be something that your locality is requiring. Is the self-attestation form enough to go off of for rental payments without doing additional research on the landlord property to prevent fraud situations? Basically, should we be taking their word with no questions asked? You know, one of the things in terms of the self-certification form is that we've had a lot of grantees who have used the home self-certification. And then coupled with that, they attach their lease agreement that goes along with that. That is something that you will definitely need to be able to, you know, kind of take into account in your policies and procedures with what you're asking for with documentation. You know, when we're looking at rent and mortgage, everyone should have a rental agreement or a mortgage statement itself. So you should have documentation that you can stick with that self-certification form itself to prove that they are the occupant of the structure itself. And that would help you out in terms of of your fraud, but that's something that you have to identify in your policies and procedures that you're requiring that they give you. If the individual can't, then they should be able to get that from their landlord or their mortgage company. If they cannot, then perhaps they're not the occupant of the structure. So that's something that you need to outline in your policies and procedures. Is mortgage assistance only up to 3 months, or can we do up to 6 months? So that goes back to which pot of funding are you using? Are you using annual CDBG? If you are, then you're limited to the 3 months. If you're using CDBG-CV, or if you're using your FY19 or 20 funds to PPR the coronavirus, then you get the 6 months, because we have the extension of that period in the CDBG-CV implementation notice. We've had guidance in the past from HUD that CDBG-CV program will only cover rental assistance or utility assistance, but not a combination of both up to 6 month time period. Example, 3 months of rent, 3 months of water bill. Can you please confirm this? Is this true? So those are actually two separate, you would need to design those as two separate activities. There's nothing that I would say would keep you from doing that, but you need to look at emergency payments as a whole. So that's sort of your umbrella activity. And if you want to have a arm that is set up where you're doing rental and arrears, and you have a different one for, say, utilities, then you need to think about where that kind of fits into the context of emergency payments itself. So that's something that I think we need more information on to kind of figure out exactly what you're referring to. Is it 3 months of one and 3 months another, or is it 3 months at the same time? So that's a question I would ask you to send into your field office with specifically how you have that designed, or how you want to design that, so that we can help you make sure that that's set up in a way that you'll be compliant. Are we unable to cover renter's insurance? When is it written as part of a lease? So if it is included in the lease, then we get into that same situation where we have the PITI on a mortgage. If it's actually part of the lease payment, if it's part of the lease agreement, then yes, it can be covered. CDBG-CV used for prepaid cellular phones for victims of domestic violence, if the equipment is returned when they leave the program. That is an interesting question. And I am not sure about that. I know we do not pay cell phone bills, but the interesting aspect of that question is how that fits in the context of delivery of that public service. That's another one that I would send into your field office, so we can take a look at and see if that is allowable or not. Don't think I've ever been asked that question out of the 20-something years I've worked with the program. I missed it. Were gift cards, gas cards, bus cards eligible purchases? No, they're not. It does get interesting when we start talking about bus cards, which is a separate discussion in and of itself, and how that is tied into a particular CDBG activity. If you want to do that, that's another item you've got to send into your field office so we can see what the context is of that, because there's just not enough context in that question. Our policy states that utilities include gas, water, internet, phone. Are some of these not allowed? So in terms of the internet and the phone, what we have said in the past is that if those are hardwired, in other words, if that's an actual infrastructure piece, then we'll cover that. We certainly have been, we've had session at the last conference. We have a broadband quick guide out as well in terms of paying that. That's an area we kind of have shied away, I guess, in the past, if you want to look at it that way, because the definition has changed quite a bit. But with the pandemic, it is very apparent that Wi-Fi is needed. So we have explored that policy. If you want to take a look at the broadband and quick guide, that'll give you a little more guidance in terms of your internet and phone. Or the matrix code. There is a matrix code for emergency payments, and I don't have that on the top of my head. If you Google IDIS matrix codes, that will take you to that PDF that'll put it in there. I do not have Puping Wong with me here today, who is our IDIS expert, who would be able to pull that out of thin air and give you that answer. Please explain current month. For instance, we are still in January. January is past due. Is February current month, or is January current month? So you're still in January and it's past due. I would say that would be your current month if we're still in January. Most mortgage and rental places will give you, say, a 5 or 10 day period, but you're still in that month. You can still make the January payment and consider that the first month. If you waited till February, and then obviously the February bill is coming up, say on the 5th or the 10th, then you would be considering January an arrear payment that you would make in conjunction with the February payment. Once the beneficiary has exhausted their series of assistance, is my understanding the grantee needs to document the beneficiary can make future payments. If the grantee can't document this, then is the grantee unable to provide assistance? No, you'd still be providing assistance, but this is where, as a grantee, you've got to design a program where you're taking them from that emergency situation to that more permanent solution. It doesn't mean you turn them away because they don't have that outlined yet. In that case, you would be causing homelessness, and we want to try to stop homelessness. But you've got to design a program where you lead them to something else. You help them get to a space where they're more secure. Again, CDBG is a gap funder. We're not the end solution by any means. The way emergency payments are designed, again, this is a carve out in the ineligible activities, and it's carved out on purpose so that we can try to mitigate any kind of homelessness, but more importantly, so that we can get people from the situation where they are in dire need to something that's more permanent. The onus on how that's done is on you. We provide a way to fill the gap, but it is up to the grantee to design a program to get them to a more permanent solution. Can you please review acceptable procedures when a visual lead inspection identifies lead hazards? That is like way outside of my wheelhouse. HUD has a Healthy Homes lead-based paint office. They have plenty of things on the website, and you can also contact that office and they will walk you through that. I know there are other things that kind of come into play with that, with the EPA in terms of the RRP and some of the other things. You will need to have technical assistance that's beyond what I'm capable of for that. Please clarify if you have 3-month rental assistance program, do you have access the need each month before you make payments during the 3-month period? Do we have to access the need? I'm assuming you probably mean, do we have to assess the need? Yes, you have to assess the need prior to making the payment. That's how you'll determine whether or not you need to skip a payment, make a whole payment, or a partial payment. That's also where you'll have to kind of redirect the beneficiary if they need to say you have a job training program or you're requiring them to prove that they're seeking employment. You need to do that every month. Again, this isn't where the covered period begins and then there's no questions asked. This is a need-based payment, and you need to worry about that necessary and reasonable requirement in there as well. So you do have to have a way to assess the need throughout the covered period. What should we do if the program has already paid late fees to a landlord? Well, I guess you're, I guess you've already done it in that case. There's not so much you could do at that point. I would not continue to pay late fees, and I would assess your program in terms of how you approach landlords in terms of removing those late fees or waiving those late fees. I would document your file in that case that you had a discussion with the landlord. You can see if in a subsequent payment, if they would take those late fees into account by reducing the rent. That would probably be the best way to document your file, is just have a discussion with them with handling it that way. Is assistance based on the household or the property? I'm assuming in that question, you're probably asking about maybe the size of the payment versus the household itself. Again, the concern with how much it actually costs is up to you. But we're assisting the household, not the property. But that's where you need to figure out what your thresholds are in terms of how much you're actually going to pay. As a grantee, how do we handle conflicting information we have been provided by HUD? Well, the easiest way to do that is to write out what it is you're seeking and what the conflicting information is, and send it to your field office. And you can always request to your field office that they consult with the headquarters program office to come up with clear guidance or to sort out that you've been given. That's happened in the past. It's bound to happen. Our field reps handle multiple programs, and some field reps that you have may be more of a subject matter expert in one program versus another. That is the benefit of having the program office at headquarters, because that's all we do is CDBG. We serve the homeless population and we provided bus tickets for them. Can we use funds for this? That is mainly another program that provides bus tickets. We have answered that question before. That is one that we usually answer through email. That can get tricky in terms of who's actually receiving the payment on the back end and how the bus service is set up. We're confused about the lead-based paint regulation. When does the lead-based paint visual inspection kick in? It's 100 days. So that first 100 days, they consider a grace period. And by the time you get to that 100 days, you need to have that visual inspection come in. So if you're looking at CDBG assistance, the date of the assistance, or the date the first payment is made, is when the clock starts on that. So you can't go past 100 days and still assist them with CDBG until that visual inspection is done. Is there guidance regarding late fees not being an eligible cost on our emergency housing assistance payments? It is in 2 CFR under the allowable and allocable cost. That is listed in there. AAQ told me I could pay late fees, but we'll have to look into that. Depends on when you actually got that answer as well.
James, I don't mean to interrupt, but I did want to let you know that we have about 1 minute remaining in the session.
Okay. Okay, well, I guess we got time for one more here. The IDIS assistance payment definition states rental, mortgage, or utility assistance. So does that mean a beneficiary could receive either rent, mortgage, or utility assistance, but not both through CDBG-CV assistance program? No, I mean, the IDIS matrix code is the way in which you're classifying that activity in the assistance in the system itself. So any any of those activities, when you tie it to that matrix code, that's how you're able to pull. It's how it's able to be classified. So we could run a report and actually look and see how many activities are set up throughout the portfolio and how much a grantee has expended for that. So again, don't confuse activity eligibility with what is a coding requirement within the IDIS system. So it looks like we are at time now, Mark. Well, thank you, everyone. Lots of questions. If you didn't get your question answered, please send it in through your field office. Let them know you were in this session, and we will get you answers to your questions. Thank you for your time this morning. And again, thank you for your participation in the conference. I hope you enjoy the rest of the week.